Welcome to the new episode of Dr. Kayhan Health Show. Today we will talk about many new interesting health subjects. This program will be divided in 4 sections. In the first section, we will talk very popular disease, AIDS. And the second one is a mysterious of everybody. We will talk hemorrhoidal diseases. And the third one, in the third section, we will talk teas. This teas is mysterious, interesting teas which are used for our health problems. And the last section, we will talk about new health features, articles about healthcare. And let's start with AIDS. How can we live with an AIDS patient or HIV positive case? How can we live with an AIDS patient or HIV positive case? And what is AIDS? In June 1981, the sentinel case of the acquired immune deficiency syndrome were firstly reported. The approach to diagnosis and treatment in HIV-infected patients is no different than for uninfected patients. A careful history and physical examination, appropriate use of laboratory tests, development of a differential diagnosis, and initial approach to therapy are all still required. Although some of the opportunistic pathogens that are so common in HIV infection may be unfamiliar to the practicing primary care physician, information regarding current approaches to diagnosis and therapy of these pathogens is contained within this part. Since the first case of the acquired immune deficiency syndrome were reported in 1981, infection with the human immune deficiency virus 1 has become a global medical crisis. An estimated 20 million persons worldwide have become infected with HIV-1 and related retroviruses through sexual, parental, or perinatal exposure. The vast majority of infected individuals, if not all, can be expected eventually to develop symptomatic disease characterized by progressive and ultimately profound immune suppression. The immunologic deficits associated with HIV infection are widespread and involve numerous interdependent effector arms of the immune system involving both cellular and humoral elements. The hallmark of HIV infection is progressive depletion of the CD4 helper inducer subset of lymphocytes. The potential causes of CD4 cell depletion is 5 reasons. The first one is direct toxic consequence of infection. The second, syncytia formation. The third, innocent bystander destruction of cells with absorbed GP120. And the fourth, HIV infection of stem cells. And the fifth one is autoimmune destruction. We know that there is two type HIV, 1 and 2. HIV-1 is the main factor for AIDS. HIV-2 was isolated, molecularly cloned and characterized and shown to represent a second major class of human immune deficiency viruses termed HIV-2. there are some major differences in the genomic organization of HIV-1 and HIV-2. Nearly 60% of reported cases in adults have been in homosexual or bisexual men without a history of intravenous drug use, and 7% have been in homosexual or bisexual IV drug users. More than 63% of the reported cases in heterosexual men and women had a history of IV drug use, including slightly over half of the cases in women. 1% of adults with AIDS had hemophilia or other coagulation disorders. 2% of cases were associated with transfusions. These are blood transfusions and blood products transfusions. 84% of pediatric AIDS cases resulted from perinatal HIV infection and maternal breastfeeding also. AIDS is the combination of disease complexes which are occurred by immune deficiency. Some of them are candidiasis of esophagus, trachea, bronch or lung, cryptosporidiosis with diarrhea, this is much more longer, 1 month, CMV viruses, herpes simplex virus, mucocutaneous ulcers or esophagitis, which is longer than 1 month, Kaposi sarcomas, degrees from 60 years age, lymphoma of the brain, decreasing from 60 years of age. Progressive multifocal leukoencephalopathy, coccidioidomycosis, HIV encephalopathy, histoplasmosis, toxoplasmosis, disseminated histoplasmosis, non-Hodgkin's lymphoma, Mycobacterium tuberculosis, isosporiosis with diarrhea, which is much more longer, 1 month, Salmonella septicemia, HIV wasting syndrome, this is an important syndrome in HIV also, CMV retinitis with loss of vision, interstitial pneumonia, this is much more invaded in HIV, brain toxoplasmosis, this is invaded and especially found in children, pneumocystis carinii and pneumonia. HIV virus classification system, it's divided in 4 groups, and the first group acute infection, and the second one asymptomatic infection, third one persistent generalized lymphadenopathy, and the fourth other diseases. The fourth is divided in 5 groups, A, B, C, D, E. A is constitutional disease including HIV wasting syndrome. B, neurologic disease including HIV encephalopathy. C, secondary infectious disease. And the group D, secondary cancers. And the last one, group E, other conditions. Modes of transmission of HIV, this is an important factor. First one is, and this is the popular one, sexual transmission. The predominant mode of HIV transmission throughout the world is sexual contact. The risk of acquiring HIV infection during a single sexual contact depends upon several factors. Most important, of course, is the likelihood that the contact is with an HIV-infected partner. In epidemiologic studies among homosexual men, the risk of HIV acquisition increases with the number of sexual partners and the frequency of receptive anal intercourse and practices associated with rectal trauma, such as receptive fisting and anal touching. Although the frequency of female-to-female transmission would seem to be quite low, such HIV infections associated with traumatic sexual practices have been reported. Most heterosexual transmission of HIV occurs during vaginal intercourse, although some studies suggest that receptive anal intercourse increases the risk of HIV transmission from an infected man to woman. Several studies have documented that infections such as Haemophilus ducreyi, Treponema pallidum, herpes simplex virus, and other pathogens causing genital or anal ulcers facilitate acquisition or transmission of HIV through sexual contact, most likely by disrupting the genital or anal skin and mucous membranes. The second one is transmission through parenteral exposure to blood or blood products. HIV is transmitted to IV drug users by parenteral exposure to contaminated injection equipment, including needles. The main risk is in IV drug users by sharing same needle. The third one, healthcare and laboratory workers. Exposure to HIV-infected blood poses a definite occupational risk of HIV infection for health carriers, laboratory, and theoretically other workers. This risk is 0.3%. The fourth one is perinatal transmission. HIV is transmitted from an infected woman to her fetus or newborn during pregnancy or delivery or through breastfeeding. The fifth one and the last one is other modes of transmission. There has been considerable concern about other theoretical models of transmission, especially through causal contact with HIV-infected persons, exposure to saliva or aerosols or insect vectors. What is natural history of HIV infection? The time period between HIV infection and the development of AIDS is long and variable, approximately 5 or 10 years. During this period, patient has HIV positive, but he can't have any symptoms. What is safe and unsafe sexual practices for preventing from HIV? Safe one, abstinence of sex. And the second one is monogamous relationship with confirmed seronegative partner. The third one, manual sex. Fifth one, kissing. And the sixth one is intercourse with latex condom, used in combination with non-oxynol 9. Unsafe one is intercourse with natural skin condom. The second one, intercourse with latex condom lubricated with petroleum-based lubricants. And the third one, unprotected urogenital sex, unprotected vaginal intercourse, unprotected anal intercourse. What is universal precautions from HIV? First one, specimens including blood products, and body fluids obtained from all patients should be considered hazardous and potentially infected with transmissible agents. The second one, hand washing should be performed before and after patient contact, after removing gloves and immediately if hands are grossly contaminated with blood. The third one, gloves should be worn when hands are likely to come in contact with blood or body fluids. The fourth one, gowns, protective eyewear and masks should be worn when splashing, splattering or aerosolization of blood or body fluids is likely to occur. The fifth one, sharp objects should be handled with great care and disposed of in impervious receptacles. The sixth one, needles should never be manipulated, bent, broken, or recouped. The seventh one, blood spills should be handled via initial absorption of spill with disposable towels, cleaning area with soap and water, followed by disinfecting area with 110 solution of household bleach. 8. Contaminated reusable equipment should be decontaminated using heat sterilization, or when heat is impractical, using a mycobacterial cleanser. The ninth one, pocket masks or mechanical ventilation devices should be available in areas where cardiopulmonary resuscitation procedures are likely. 10th, healthcare workers with gauze lesions or weeping dermatitis should avoid direct patient contact and should not handle contaminated equipment. The 11th one is private rooms are not required for routine care select circumstances. However, such as the presence of concomitant transmissible opportunistic diseases may warrant respiratory, enteric, or contact isolation. What's hemorrhoids? How can we treat it? And how can we success for the protection against hemorrhoids aggravation? Hemorrhoids results from hyperplasia of the sinusoidal hemorrhoidal cushions, also known as corpus cavernosum recti. It helps to control of continence. They are supplied by 3 branches of superior rectal artery. The hemorrhoidal cushions are typically located at 3, 7, and 11 o'clock dorsal lithotomy position. According to this knowledge, we understand that there is 3 cushions and simply names right anterior cushion, right posterior cushion, left lateral cushion. Hemorrhoids are found on examination in about 70% of adults over 30 years of age. This high percentage makes abundantly clear that the vast majority of individuals with hemorrhoids are asymptomatic. Hemorrhoids are a disease of vascular structures, and as long as there is normal blood flow, problems are unusual. When there is impaired blood flow in the sinusoidal cushions associated with inflammation and spread to adjacent tissues, then pain, discharge, bleeding, and other symptoms may occur. Hemorrhoids are typically graded according to the following system. First one, grade 1, hemorrhoids protrude into the rectal lumen but do not prolapse. The second one, this is the invited form, hemorrhoids prolapse with straining or bowel movement but spontaneously return. The third one, prolapse hemorrhoids must be digitally replaced. The fourth one, hemorrhoids are permanently. What is the predisposing factors for hemorrhoids? First one is prolonged sitting, lack of activity, obesity, pregnancy, connective tissue weakness, increased anal sphincter tone, excessive straining on defecation. The last is too important. The main cause is a low roughage diet leading to chronic constipation. The persistent strain impairs the transsphincteric flow of blood during defecation. This leads to the build-up of blood in the hemorrhoidal cushions, initially with simple stretching of the tissues, but eventually with a hyperplastic and fibrotic response. What is symptoms? The main symptom is pain or burning. The second one is bleeding. This is too popular for going to the doctor after this bleeding. And the third one is itching. Often the presence of blood on their stools is the complaint which brings the patient into the office. What is its therapy? The marked clinical variability of hemorrhoids means that there is no ideal single therapy. Firstly, hot sitz bath, approximately 10 minutes, 2 times per day. This is too important for the acute inflammation of hemorrhoids treatment. Then, topical medications and suppositories decrease the symptoms also, but they must be used after hot sitz bath. Also, diet is an important another factor. Increasing fibers in the diet is decreased constipation and decreased hemorrhoids. The other treatments, first one is hemorrhoidectomy. Only a small number of patients require surgery. Most often, it's patients with grade 3 and 4 diseases who make up at most 10% of patient population. The second one is cryosurgery. In this treatment, we usually employing liquid nitrogen or nitrous oxide. This is a relatively painless approach. The third one, rubber band ligation. This is a popular treatment for hemorrhoids, especially grade 2 and 3 hemorrhoids, using a proctoscope and a specially designed ligating forceps or gun. A rubber band is placed about the base of an internal hemorrhoid nodule, thus eventually strangulating it. After a few days, the necrotic tissue and the rubber band is passed into the stool. About 3 weeks are required for the site to heal and become completely covered with mucosa. Rubber band ligation is especially well suited for the treatment of grade 2 and occasionally grade 3 hemorrhoids. The fourth one is infrared photocoagulation. This is the band of a kind of laser. After this infrared, there's a frequency of laser starting. Using a proctoscope, defined amounts of infrared energy are delivered to the hemorrhoidal tissue via a rigid light tube. The physics of the system are such that the bulk of energy are applied submucosally. Coagulation necrosis results and the vascular supply of the sinusoids is disrupted. 2 weeks, there is a small sunken scar, which another 2 weeks is covered with mucosa. Usually, 4 treatment sections at 4-week intervals are required, as only 4 sites should be coagulated each session. The fifth one is sclerotherapy. It's widely used for grade 1 and 2 hemorrhoids. There are too many different sclerosing solutions. Contraindications for sclerotherapy include pregnancy, hemorrhagic disorders, Crohn's disease, ulcerative colitis, predisposition of thrombosis, etc. 0.5 or 2 milliliter of sclerosing solution is injected in the submucosa at the base of the hemorrhoids in the vicinity of the supplier vessel. The entire treatment involves 2-4 sections at 1 to 4 week intervals. When the injections are correctly placed, they cause pallor and swelling of the mucosa injection, which are too superficial, lead to ulcerations, necrosis, and bleeding, while those which are placed too deep into the muscularis result in pain. And now we are talking about third section. We talked about healthy teas. First one is ginger tea. This is an immune modulator, anti-flu effect, concentrated dyspepsia. It's effective for vertigo and emesis. It's good for insomnia. It increases metabolic activity. By the help of this, it's good for losing weight. It stops pregnancy emesis. It decreases hypertension. Second one is Calta edulus. This is also called Arabic tea. It decreases body edema, also diuretics. It burns body fats, antibiotic. It stops diarrhea. It decreases the absorption of fats from the intestines. Third one is Echinacea tea. This is an immune modulator, protects from respiratory viruses, example influenza, protects body from oxidative stress, increase bowel movements, anti-inflammatory effects. And fourth one is fennel tea. It's rich from vitamin B, C, potassium, magnesium, calcium. It protects from dyspepsia, diuretic, decreasing hypertension, decreasing osteoporosis, decreasing the pain of teeth, decreasing fasting illness, decreasing the pain of menstrual cycles. Next is rosemary tea. It includes calcium, iron, vitamin B6. It's good for the dyspepsia. It increases memory and concentration. It's good for cold. It protects from cancer. Immune modulator. It increases body blood circulation, so it's good for hypotension. It can be consumed during liver diseases. It decreases fasting sugar level. It decreases rheumatic pains severity and migraine pain severity. The other one is Melissa tea. It includes sodium, potassium, vitamin C, vitamin B1, vitamin B2, iron, manganese, chrome, selenium, copper, and zinc. It has sedative effect. It decreases stress. It's good for insomnia. It decreases gastric disturbance. It increases digestion. It's good for urinary infection. It decreases intestinal gases. It decreases fever. It helps healing of wounds. It increases sweating. Next one is chamomile tea. It decreases edema. It's good for all rheumatic diseases. It's anti-allergic. It's good for irritable bowel syndrome. It decreases back pain, immune modulator, anti-cancerogen, inhibits osteoporosis. It's good for reflux diseases. It inhibits migraine attacks. It has antipsychotic effect. Lavender tea, immune modulator. It decreases body edema, antidepressive, decreased anxiety. It inhibits insomnia. It decreases bowel gas. It treats dyspepsia. It decreases coughness. It inhibits fever. It's good for headache. Ginkgo tea. It heals headache. It gives energy. It decreases dyspepsia, antioxidant. It decreases stroke risk. It's good for Alzheimer. It decreases coughness. It decreases emesis. Also, it's antidepressive and increasing staying young, increase the body blood circulation, and inhibits tinnitus. It increases teaching ability. Dandelion tea. It inhibits edema. It includes vitamin A, vitamin C, potassium, iron, calcium, magnesium, zinc, and phosphor. After this tea, your acne is easily disappeared. It's a diuretic. It increases digestion, supports both renal and liver system functions, antioxidant. It's good for hyperuricemia in gut diseases. It's good for pancreas also. White tea, it's popular in Turkey also. It's too important because it's anti-cancerogenic. It increases blood circulation level and it decreases myocardial infarction risk. This is an antioxidant. It's produced from the leaves of Camellia sinensis. It decreases blood triglyceride level and increases metabolic activation. Oolong tea, some kind of green tea, antioxidant, anticarcinogen. It decreases the risk of gastric cancer. It regulates blood sugar level. It inhibits osteoporosis, anti-anxiolytic, and it decreases body blood pressure. Mate tea. It is used for the treatment of depression. It opens all sinuses, anti-allergic, antioxidant. It increases sensation and concentration. Immune modulator effect and anti-inflammatory effect also. It's a diuretic. It helps increasing of metabolic level. Let's talk the fourth and last section. This is about the news health system. We will talk five news. The first one is important because if you remember the other parts of this program, we will always talk about kefir and probiotics. This is news included about these probiotics. Blood fecal bacteria composition differed between lean and obese patients with fatty liver disease. In the gut microbiota, for example, a decrease in bacteria of the family Desulfovibrionacea was associated with non-alcoholic fatty liver disease in the lean and non-alcoholic fatty liver disease group, but not in the obese non-alcoholic fatty liver disease group. Succini Vibrinosaena showed opposite correlations in the lean non-alcoholic fatty liver disease group and in the obese non-alcoholic fatty liver disease group. The second news is an effective preventive therapy is needed for hepatocellular carcinoma, the second leading cause of cancer of death worldwide. Persistent infection with the hepatitis B virus accounts for 24 to 40% of hepatocellular carcinoma in hepatitis B virus carriers. Daily aspirin tied to 29% risk reduction of hepatocellular cancer carcinoma in vitro hepatitis. The third one is one of the challenges in treating patients with hemophilia A is that when they receive the standard treatment for the disease factor VIII replacement therapy, many development neutralizing antibodies that make factor therapy ineffective. Recent developments in hemophilia therapy with emicizumab development finally provides hemophilia a patient with inhibitors as an attractive option to reduce the risk of bleeding. The fourth one, if you are 70 years old, it's time you underwent skills testing. The fifth one, in September, the United Nations held its first ever high-level meeting about tuberculosis with the goals of treating 40 million people and preventing 30 million new cases from 2018 and 2022. This new report says that a tuberculosis-free world is possible by 2045 if increased political will and financial resources are targeted towards areas where they are needed most. And this is the last. This is the end of our program. In this program, we talk a lot of interesting section. The first one is AIDS, the second one is hemorrhoids, and also we learn a lot of new things about magic teas. However, we mustn't forget that if we can't occur correct correlation between mouth and brain, we can easily lose our health.